Hey everyone, Dr. Mike here. Today, we're diving deep into a topic that's crucial for your overall health: kidney failure. Your kidneys are the silent workhorses of your body, filtering waste products, balancing electrolytes, and regulating blood pressure. When they fail, your body struggles to function properly. Now, kidney failure can sneak up on you. It often develops slowly, with subtle symptoms that many people brush off. That's why it's so important to understand the signs and catch it early. There are two main types of kidney failure: acute and chronic. Acute kidney failure happens suddenly, often due to an injury or illness. Chronic kidney failure, on the other hand, develops gradually over time, usually due to conditions like diabetes or high blood pressure. In this video, we'll explore the common symptoms of both types so you can stay informed and take charge of your health. Let's talk about a symptom that might seem obvious but is often overlooked: changes in your urination. Your kidneys are responsible for filtering waste products from your blood and producing urine. When they're failing, this process gets disrupted. One of the first things you might notice is a decrease in the amount of urine you're producing, especially during the day. You might find yourself going to the bathroom less frequently or passing only small amounts of urine when you do go. This can be a sign that your kidneys aren't filtering your blood effectively. Now, it's important to remember that everyone's bathroom habits are different. What's normal for one person might be a red flag for another. However, if you notice a sudden and significant decrease in your urine output, especially if it's accompanied by other symptoms we'll discuss, it's crucial to see a doctor right away. On the flip side, some people with kidney failure might actually experience an increase in urine output, particularly at night. This is because their kidneys are losing their ability to concentrate urine, leading to more frequent trips to the bathroom. Again, any significant changes in your urination patterns should be checked out by a healthcare professional. Moving on to another common symptom of kidney failure: swelling, also known as edema. This occurs when your kidneys can't keep up with their job of removing excess fluid from your body. Think of your body like a well-maintained plumbing system. Your kidneys act as the filters, ensuring a smooth flow. But when those filters are clogged, water starts to back up, leading to swelling in different parts of your body. You might notice this swelling in your legs, ankles, and feet, especially after standing or sitting for long periods. It can also affect your hands and face, making it harder to wear rings or notice changes in your facial features. This fluid retention can be uncomfortable and even painful. If you press on the swollen area, it might leave a small dent that takes a while to disappear. This is called pitting edema, and it's a classic sign of fluid buildup. Remember, swelling isn't always a sign of kidney failure, but it's definitely something you shouldn't ignore, especially if it's persistent or accompanied by other symptoms. Feeling tired after a long day is normal, but if you're constantly exhausted, even after a good night's sleep, it could be a sign of something more serious, like kidney failure. When your kidneys aren't working properly, waste products and toxins start to accumulate in your bloodstream. This buildup can make you feel incredibly fatigued and weak, like you're dragging yourself through the day. Imagine your body as a high-performance car. When your kidneys are functioning optimally, they're like a top-notch fuel filtration system, keeping your engine running smoothly. But when those filters get clogged, your engine starts to sputter and struggle, leading to decreased performance and that feeling of constant exhaustion. This fatigue can also be linked to anemia, a condition that often accompanies kidney failure. Anemia occurs when you don't have enough healthy red blood cells to carry oxygen throughout your body. This lack of oxygen can leave you feeling weak, dizzy, and short of breath. If you're experiencing persistent fatigue and weakness, especially if it's a new symptom or it's getting worse, it's essential to talk to your doctor. Now let's talk about a symptom that can be quite alarming: shortness of breath. While it's often associated with respiratory issues, it can also be a sign of kidney failure, especially when fluid builds up in the lungs. Remember how we talked about fluid retention earlier? Well, sometimes that excess fluid can accumulate in the space around your lungs, making it harder for them to expand fully. This can lead to shortness of breath, especially when you're lying down or exerting yourself. Imagine trying to inflate a balloon that's already partially filled with water. It takes more effort, right? That's similar to what happens to your lungs when they're surrounded by excess fluid. You might find yourself gasping for air, feeling like you can't quite catch your breath. This shortness of breath can be accompanied by a persistent cough or wheezing as your body tries to clear the fluid. If you're experiencing sudden or severe shortness of breath, especially if it's accompanied by chest pain or a bluish tinge to your lips or fingernails, seek emergency medical attention immediately. Nausea and vomiting are never pleasant experiences, and they can be caused by a wide range of factors. But when they become persistent or unexplained, they could be a sign of something more serious, like kidney failure. Remember those waste products and toxins we talked about earlier? When your kidneys aren't filtering them out effectively, they can build up in your bloodstream and irritate your stomach lining, leading to nausea and vomiting. Think of it like this. Your stomach is like a sensitive sensor, alerting you when something's not right in your body. When it detects a buildup of toxins, it sends out signals that trigger nausea and vomiting, almost like a protective mechanism to try and expel the harmful substances. This nausea and vomiting can be worse in the morning or after eating certain foods. You might also experience a metallic taste in your mouth, loss of appetite, and unintentional weight loss. If you're experiencing persistent nausea and vomiting, especially if it's accompanied by other symptoms like fatigue or changes in urination, it's crucial to consult your doctor. We all have days when our appetite isn't quite there, maybe due to stress or a busy schedule. But a persistent loss of appetite, especially if it's accompanied by unexplained weight loss, can be a red flag for a variety of health issues, including kidney failure. When your kidneys aren't functioning properly, those waste products we keep mentioning start to accumulate in your bloodstream. This buildup can affect your sense of taste and smell, making foods seem unappetizing. Imagine trying to enjoy a delicious meal in a room filled with a foul odor. It's hard to appreciate the flavors when your senses are overwhelmed by something unpleasant. Similarly, when your body is overloaded with toxins, it can dampen your desire to eat. This loss of appetite can also be linked to nausea and vomiting, which we discussed earlier. If you're constantly feeling nauseous, the thought of food might make you feel even worse. If you're experiencing a persistent loss of appetite, especially if it's accompanied by unintentional weight loss or other symptoms like fatigue or swelling, it's important to talk to your doctor. We all experience the occasional itch, whether it's from a mosquito bite or dry skin. But persistent itching, especially if it's widespread and not related to any obvious skin condition, can be a sign of something more serious, like kidney failure. When your kidneys aren't filtering your blood effectively, waste products and toxins start to build up. This buildup can irritate your skin, leading to persistent itching that's often difficult to relieve with over-the-counter creams or lotions. Imagine your skin as a delicate ecosystem. When your kidneys are functioning properly, they help maintain a healthy balance, removing waste products that can disrupt this balance. But when those waste products accumulate, they can trigger an inflammatory response in your skin, leading to itching and discomfort. This itching can be worse at night, disrupting your sleep and making it difficult to get comfortable. You might also notice dry skin, rashes, or changes in skin color. If you're experiencing persistent itching that's not relieved by over-the-counter remedies, especially if it's accompanied by other symptoms like fatigue or changes in urination, it's essential to consult your doctor. Chest pain is always a concerning symptom, and it's crucial to take it seriously. While it's often associated with heart problems, it can also be a sign of kidney failure, especially when fluid builds up around the heart. Remember how we talked about fluid retention earlier? Well, in some cases, that excess fluid can accumulate in the sac surrounding your heart, called the pericardium. This fluid buildup can put pressure on your heart, leading to chest pain or a feeling of tightness in your chest. Imagine your heart as a fist, rhythmically pumping blood throughout your body. Now, imagine that fist enclosed in a tight, fluid-filled balloon. That pressure can restrict your heart's ability to pump effectively, leading to chest pain and discomfort. This chest pain might be sharp or stabbing, or it could feel like a dull ache or pressure. It might worsen when you take a deep breath or lie down, and it might be accompanied by shortness of breath or a rapid heartbeat. If you're experiencing sudden or severe chest pain, especially if it's accompanied by shortness of breath, sweating, or pain radiating to your arm or jaw, call emergency services immediately. High blood pressure, also known as hypertension, is often called the silent killer because it often doesn't cause noticeable symptoms in its early stages. However, it's a major risk factor for a variety of health problems, including kidney failure. Here's the thing. High blood pressure and kidney failure are often caught in a vicious cycle. High blood pressure can damage the delicate blood vessels in your kidneys, impairing their ability to filter waste products effectively. As kidney function declines, it can further contribute to high blood pressure, creating a dangerous downward spiral. Imagine your blood vessels as a network of highways transporting vital nutrients and oxygen throughout your body. High blood pressure is like heavy traffic, constantly pounding on these highways, causing wear and tear over time. This damage can lead to narrowing and hardening of the arteries, making it even harder for blood to flow through and increasing the pressure even further. This is why managing your blood pressure is crucial for protecting your kidney health. If you have high blood pressure, work closely with your doctor to keep it under control through lifestyle modifications and, if necessary, medication. We all have moments of forgetfulness or difficulty concentrating, especially when we're stressed or tired. But if you're experiencing persistent confusion, difficulty concentrating, or changes in your mental sharpness, it could be a sign of something more serious, including kidney failure. Remember those waste products and toxins we've been talking about? When your kidneys aren't filtering them out effectively, they can build up in your bloodstream and affect your brain function. This buildup can lead to a range of cognitive problems, from mild forgetfulness to severe confusion and disorientation. Imagine your brain as a complex computer system processing information from your senses and coordinating your thoughts, emotions, and actions. When toxins accumulate in your bloodstream, it's like introducing a virus into this intricate system, disrupting its normal processing power and leading to cognitive glitches. You might find yourself struggling to remember recent events, having trouble following conversations, or feeling disoriented in familiar surroundings. If you're experiencing persistent cognitive problems, especially if they're new or worsening, it's essential to talk to your doctor. Muscle twitches and cramps are often harmless, caused by things like dehydration or overuse. But when they become frequent, severe, or unexplained, they could be a sign of something more serious, like electrolyte imbalances, which can be a complication of kidney failure. Your kidneys play a crucial role in regulating electrolytes in your body, such as sodium, potassium, and calcium. These electrolytes are essential for muscle function, nerve transmission, and fluid balance. When your kidneys aren't functioning properly, these electrolyte levels can become dangerously imbalanced, leading to muscle twitches, cramps, and even more serious complications. Imagine your muscles as finely tuned instruments relying on a delicate balance of electrolytes to function properly. When these electrolyte levels are disrupted, it's like throwing those instruments out of tune, leading to spasms, cramps, and impaired performance. You might experience muscle twitches in your eyelids, face, or hands. You might also have muscle cramps in your legs, feet, or abdomen, especially at night. If you're experiencing frequent or severe muscle twitches or cramps, especially if they're accompanied by other symptoms like fatigue or changes in urination, it's important to talk to your doctor. We all have nights when we toss and turn, struggling to get a good night's sleep. But if you're experiencing persistent sleep problems like insomnia or restless leg syndrome, it could be a sign of something more serious, including kidney failure. When your kidneys aren't filtering your blood effectively, waste products and toxins start to build up. This buildup can disrupt your sleep-wake cycle, making it difficult to fall asleep, stay asleep, or achieve restful sleep. Imagine your body as a finely tuned clock, regulating your sleep-wake cycle with precision. When toxins accumulate in your bloodstream, it's like throwing sand in the gears of this intricate clock, disrupting its rhythm and leading to sleep disturbances. You might find yourself lying awake at night, your mind racing with thoughts. You might also experience restless leg syndrome, an irresistible urge to move your legs, especially at night. This can make it incredibly difficult to fall asleep and stay asleep, leading to daytime fatigue and impaired concentration. If you're experiencing persistent sleep problems, especially if they're new or worsening, it's essential to talk to your doctor. That was a lot of information, but I hope you found it helpful in understanding the complexities of kidney failure. Remember, your kidneys are vital organs that play a crucial role in your overall health. If you're experiencing any of the symptoms we discussed, especially if they're persistent or worsening, please don't hesitate to seek medical attention. Early detection and treatment are key to preventing further complications and maintaining your kidney health. As always, this video is for informational purposes only and should not be considered medical advice. If you have any concerns about your health, please consult with a qualified healthcare professional. Thank you for joining me on this deep dive into kidney failure. Don't forget to subscribe to the channel for more informative videos on health and wellness. Hit that notification bell so you don't miss an upload, and as always, stay healthy, stay informed, and take care of yourselves.